Thank you so much. Good morning, everyone.
Morning.
Myself, Baburam, Humagain. I'm associated with a college teaching pharmacy subject. Today, it seems a little difficult for me to talk about public health. But I'm trying to dig out some of the important issues, especially related to health in Nepal. Very happy to be the part of American University of Sovereign countries. Well, consumer, who are consumers?
We are all consumers.
We all are consumers. Those who receives commodity or services, all are consumers. One or other way, everyone is consumer. Okay, students are consumers. And the patient is also a consumer. Okay, so those who receive goods and services, they are consumers. And this concept, the consumerism, the concept, it is first in US from President Kennedy started the word consumerism, the rights of the consumer. And it was explained by various ways. There are certain principles on the consumer concept. The first concept is the consumer, you yourself become aware. The first is carried the impetus. That is, the consumer himself should be aware about the goods and services. The second principle is capite venditor. That means the service providers, you become responsible. Those who provide service, you become responsible. And the third one is doctrine of consumer sovereignty. Consumers, you are sovereign. Consumers are always sovereign. Okay? And the principle of respectfulness, that is, let consumer be respected. So these are the four principles based on the consumer rights. So UN has given guidelines focusing to developing countries. There are several things mentioned in the consumer rights by the UN guidelines. And the main reason of the guideline is consumers often face imbalance in economic terms and educational level and bargaining power. The consumers do not have much bargaining power. And if the consumer is not aware and the service providers, they do not become responsible, then that condition, consumers are cheated. The goal is to consumers should have the right of access known as hazardous products, and right to promote just, equitable, sustainable, and economic and social development and environmental. All these two are the basic goals. The Consumer International and UN guidelines has also given certain consumer rights, and in our country also, the Consumer Act has given 6 important rights of consumer. The basic right of the consumers are protection from hazards to their health and safety, promotion and protection of consumer economic interest, access of consumer of educated information. It is the duty of the government to provide information to the consumer. And consumer education also the right as the consumer rights. availability of effective consumer redress. There should be, the consumer should use the right of redress. If there is something harm from the treatment, then the government or the service provider is liable to pay the compensation. Freedom to form consumer and other relevant groups or organization and the opportunity of such organization to present their views and decision-making process. The government should involve the consumer societies and other relevant states in the developing policy relating to consumer and to establish the rights of the consumer. The promotion of sustainable consumption pattern, this is the new concept. The UN guideline has stressed this much, the promotion of sustainable consumption pattern. Now coming to right to health. We don't have any health right. We don't have patient right. The government used to say they are providing health services. Okay. Doctors or health professionals are providing services. But most of the time, in most of the countries, what we find is that is one way. A patient cannot exercise their rights. A doctor's order you. A nurse order you. A pharmacist give you information that you have to take this medicine 3 times a day. Never the pharmacist ask, what is your lifestyle? Can you manage to take this medicine 3 times a day? And sometimes the pharmacist used to say, well, this should be taken in the morning. It happens, some of you are clinicians, you know, furosemide, that is a diuretic for excess urination. What he used to say, the doctor prescribes, well, it should be taken in the morning, and because you will have more frequently urination. But never ask what time you sleep. The patient may be having night duty and he starts sleeping in the morning. So these are the things which are not usually considered. And you know, all rights are given by WHO. The right to health, safe drinking water, safe food, education, housing, healthy environment in working, health-related education, information, and gender equality. These are the basic rights, health rights as per WHO. Are you having freedom to the rights to be free from non-consensual medical treatment? Medical experiment and research are being done to the people. But it has been just the formality. Several vaccines are being experimented in Nepal also. But those whom it is being used, they never know. And there has been formalities that the consent has been taken. So in practice, what we are doing, what is happening is little different. And to be free from torture and other cruel, inhuman, these are the or degrading treatment or punishment. There are several examples. I can tell you some of those. Well, are you having the right to a system health protection providing equality of opportunity for everyone to enjoy the highest level of health? No. In practice, we should say no. The right to prevention, treatment, and control of diseases, access to essential medicines, maternal, child, and reproductive health, equal and timely access to basic health services, the provision of health-related education and information, participation of population in the health-related decision-making at the national and community level. These are the fundamental rights as per WHO. We have to find out, we have to think of it, whether we have been able to exercise these things. If not, what should be the role of the consumer? What should be the role of the government? How can this be in favor of the consumers? Well, are the services in access to you? No. In country like Nepal, they are not in excess. Is available in sufficient quantity, may or may not. Accessible physically, yes or no. Accessibility also implies the right to seek, receive, impart, acceptable and good quality, yes. We have to think of it. Well, as a patient, there are several rights of the patient. Just I spoke to you about an example. What the doctor says, normally in our context, when you have some symptom, you go to doctor and he or she asks you what has happened to you. He writes some medications. He never asks about your lifestyle. He never asks, rarely asks, what are your past medication. He never asks, what is your financial situation and what is about your family. If, for example, a 40 years of age man, has episode of on testing, say has hypertension or high blood pressure. For example, maybe 140 by 100. Well, 140 by 100. Some doctor used to write immediately, okay, you take amlodipine or so and so tablets. He is 40 years of age. The clinician never asks what impact will lead to his family. When he doesn't know, he can ask to the doctors, is only the alternative I have to get medicine? Are there any options of the treatment? These all are the right of the patient, but patient cannot exercise those rights because the physicians are superior in healthcare team. We all have recognized as the team leader of the healthcare, but has all clinicians or the service provider fulfilling their responsibility towards the patient? We have to think. Decide whether or not to undergo medical treatment after receiving reasonable explanation of what treatment involves and the risk associated with the treatment. Yes, this is the patient right. But are the patient exercising their rights? Are the service provider fulfilling their responsibility? For example, the hypertensive, may or may not be hypertensive if the blood pressure is 140 by 100. And the doctor orders the patient, okay, do you smoke? Yes, I do. You have to stop it from tomorrow. If you ask me, if I'm a smoker, I can't quit smoke tomorrow. It is difficult for me. And it is easy to order you, inform you that you will die if you do not quit smoking. And the doctor asks the patient, well, you have to go for a morning walk for a half an hour. Never ask, what is the duty hour? If the doctor says to me, I have to get at 5 o'clock in the morning, and I have to be in the college at 6, it will be difficult for me for morning walk. There will be no compliance. Okay? And also doctor, you have to decrease the salt intake and you have to increase your vegetable and the fruits intake. You have to moderate your alcohol consumption. How easy? All is easy, but not easy for me. I cannot go for exercise in the morning. And my family doesn't want to decrease the salt in the vegetables, my wife will be annoyed. And you never explain me about what is hypertension. That I go to my house and bring to my family. She'll be in torture. My parents will be in torture. Oh, blood pressure, high blood pressure. Okay, don't toss this, don't toss this, don't toss this. What is my condition? The whole family, what is the impact to the family? We never think of these issues. And this is because we are not educating the consumer. We are not fulfilling our responsibility. That is the problem. We treated with reasonable care and skill by the healthcare provider. We don't know. Once the degree is received, everybody says, I am doctor, I am pharmacist, and I am public health expert, and etc. But don't know. Are you having that capability to render the service up to the quality? We don't know. Well, to be treated with respect and courtesy, in most of the developing country like Nepal, we don't have any respect. Okay, I'm a doctor, you are a patient. Everything you have to obey. And you are not, complying to my suggestion. See, I'm not responsible. I will say like this. Should it be continued? I don't think so. To receive self-considerate, ethical and cost-effective medical care, pharmaceutical companies coming to doctor, well doctor, I will be providing your son's marriage ceremony by part. You have to write this medication for 6 months. Patient is receiving medication on the cost of pharmaceutical companies. But consumer is unaware. The service, what is being received by the consumer is not aware. And we have trust to the health professionals. A big trust to the health professional. And this trust and the pharmaceutical companies, I don't know in your country. I think in India also it is similar. In Nepal, many pharmaceutical companies I have found paying monthly salary to the clinicians. It is in India too. Okay? So, why I have to consume medicine? Because his practice. Because the sale of the pharmaceutical companies. And I have to pay a big amount because the companies have paid or sponsored to the organization. To have your individual cultural, spiritual and psychological needs be respected, very, very important. It is a big issue. You're talking about bioethics, right? Yes. It comes here. And these all things, as for the patient rights, as consumer rights, it is not being exercised everywhere. All the public health personnel should address this issue. And you should have plan to make benefited the consumers, to have your privacy and personal dignity be maintained, to expect that information regarding your care will be treated as confidential. Yes, in most of the cases it is complied. Well, to be treated with respect and courtesy, how many of you getting respect? It is based on the cost you have paid. If you are paying a high amount, you will be little respected. If you are going to a private hospital, okay, you will be getting little trust. If you are in the government hospital, and have to get service from the government hospital. What is their behavior? To receive safe, ethical, cost-effective medical care. Yes, it is done already. Okay. A patient has several rights. If I go to a clinician, the clinician should answer what has happened to me. How many of them answer? Okay, you have hypertension, that is done. But I will be worried because I have heard hypertension is a chronic disease and I have to take medicine for lifelong. Understanding diagnosis and treatment as well as the possible outcomes, risk, benefit and your care, the next part. Possible outcomes. It is the responsibility of a service provider. If I treat you, this is the prognosis, this is the possibility of cure, this is the risk associated with this treatment, and these are the alternatives in the treatment, and you chose which treatment you go. A clinician should give, the every aspect, be brave to the patient. Have information regarding your medical treatment, explain to your family members or the appropriate individual when you are unable to participate. This is the same. Access of foreign language. Yes. Be advised of hospital policies, procedure, rules, regulation. Yes. But why I am explaining this, I am trying to show these things. These are the problems in everywhere, not only in Nepal. The magnitude of the problem may be less in developed countries. Magnitude of problem may be with ethical clinicians and service care providers. Sorry, got flowing here. Have you understood about the rights to be aware of the hospital bioethics committee? You understand that your caregivers may be both teachers and students, and in most of the cases in teaching hospital, what happens? The people come with white coat, no tag. White coat, no tag. And you don't have right to ask who are you. And this is my right, whether to get treatment from you or not. How far has it been implemented in developing countries, especially? And how many clinicians and nurses introduce themselves? Well, to know the names, title of the caregiver, see your medical records, review your bill and have any questions, concern, and it is also not explained what is the amount, the tentative amount you have to spend for it. And there are several incidences in Nepal. A patient goes to hospital for one reason and dies with another reason. The another reason means where the reason pneumonia because the nosocomial infection in the hospital, and hospital is not responsible, and the patient party has to pay that bill also. See the situation. Where is the right of the patient? Where is the right of the consumer? Okay. Have you exercised your rights in the decisions concerning your care? To have your family members and other important decisions in your care? To exclude your family members and or others from participating in decision about your care, and to discuss about the planning of the treatment. Oh no, everything with the hospital. Everything with the hospital. The hospital will do. And there is no participation of patient and patient party in decision making, which is required. Yes, to give your informed consent or informed refusal for treatment. Well, in our context, the patient party knows they have to sign. If there is operation, sign. Okay, sign Garnos Yanera. You sign it here. You sign it here. Okay. Because the patient has trust to the hospital. The patient has trust to the doctor. Everywhere the patient can sign. To leave the hospital or request a transfer, to refuse to treat it by a student, to consent or decline to participate in clinical research. These all are the rights of the patients. What I am trying to relay is, these are the rights. And how can these rights be established? How can a patient can achieve this? And I think it is your concern. It is your concern. You have to develop such a policy. You have to make the patient consumer aware of it. Well, what they used to say, all we claim as professional. Are we professional? Would you recognize me? In what way? If the profession, I'm a pharmacist, but pharmacy is not my profession. Pharmacy is not my profession. My profession is teaching because my student knows a teacher. That is why I'm a professional. So, to make your profession professionalization, you have to stand for something. You have to provide service that is unique to the society. The unique service that meets the fundamental requirement of the society. If a professional is not providing service, which is recognized by the society all the time, she is not a professional. And once we obtain degree, we used to call as a profession. No. So, always we have to think what we are providing to the society. If we are providing something to the society, and society is understanding you for that unique service, then only you are a professional. Otherwise, that is not a professional. There are several characteristics that should have with a professional, that should be recognized by the society, that should be a part of the society, integral part of the society. You should have a definite skill, knowledge, and competency to use that knowledge. And if we are a profession is judged by the society. A carpenter makes his table. We recognize carpenter because the carpenter has made this table. And we are the judge. I can say, no, this should be like this. Always the patient recognize, judge the treatment, but the health service is about the health service. The consumer is not aware, patient is not aware. That is why it is very difficult to judge. The patient judges just if the symptom disappears, okay, this doctor is good. Okay? That is the way how we judge. And professionals have several opportunities to upgrade oneself with the practice. And if we are a profession, the authorities are sanctioned and limitations are given. And it is the integral part of the society and have power over client. The power is being misutilized by the health professional to the consumer. I'm not blaming all health professionals, but it is at least an issue. The providing service is not big thing. the quality of service we provide, and the outcome from that service to individual, to his family, and the whole society. If you take diabetes as a chronic disease, our society says, hey, he has diabetes, he has sugar, oh, problem. Oh, he has sugar, he has sugar, problem. What I feel? I had slight elevated glucose, and I was hypertensive. But I'm not a patient. I'm not a patient. If someone says, okay, you have hypertension, yes, you have also hypertension. I'm controlled hypertension. The society, the whole family and the society takes differently. I'm controlled diabetes, controlled hypertension, but if I go to any place, I have nothing to, okay, sugar, no problem. Meat, no problem. Fat, no problem. I have to take some sweets, no problem. No problem. I become healthy. But several people in the society, I find they are not healthy. They are on treatment. They have controlled diabetes, controlled hypertension, everything is controlled, but they are ill. And what we are doing? We means the overall healthcare team, what the clinician doing, what nurse doing, what pharmacist doing, and other health professional doing on that. Okay, I have to touch something about ethics. Yes, we all know this is a rule of moral conduct, which cannot be written in the law, and normally not written in the law. That is ethics. That comes from the moral, from inside. And if we cannot change ourselves, we can't be ethical. We have to change from inner heart. Then only ethics is established. And professional ethics is far more important, because a professional practice is not mechanical. Why? We need ethics in professional service. We need ethics in professional service because it is not used mechanically. No, 1 plus 1, 2. No, 1 plus 1 may be 3, 1 plus 1 may be 1.5. That is why ethics is required in professional, and this ethics cannot be written in the law. Very difficult. We have to bring it from our inner heart. Well, there are several code of ethics given by professional societies. You must be aware about the fairness, equity, courtesy, collaboration, respect, recognize. These are the ethical principles. And equal professional standard, honesty, integrity, professional skill up to date, make your professional skill up to date, comply with the legislation, ensure competency and subordinate staff, ensure your service is correct. These are the core of ethics given by medical community, has given clinicians, they have own ethics, and ethics is endorsed by the professional councils, pharmacy has their own ethics, nursing, they have their own ethics. Now coming to the Nepalese context. What I try to explain to you is the consumers, especially the health consumers, they are being cheated. They are not getting proper service. Now what is in Nepalese context? Our constitution has given rights to the consumer. What it says in Article 44, the right of consumer, every consumer shall have the right to obtain quality goods and services. Both. This is written in the Constitution of Nepal. right to have quality, but quality means there should be at least a standard. Standard, without a standard, quality doesn't come. Goods and services. A person who has suffered injury from any substandard goods or services shall have the right to obtain compensation in accordance with the law. So we are little ahead. Many countries do not have this under Constitution. This is very important. These are very important provisions in the Constitution that we get compensation if we are being cheated in getting service or commodity. Similarly, we are also very forward in health. We have a right relating to health. This is also the fundamental right. Every citizen shall have the right to free basic health services from the state, and no one shall be deprived of emergency health services. So Nepalese people are given assurance through the Constitution that they will get every service, and basic service free, and even emergency service also free, and you will not be deprived. But if I made an accident here and go to a hospital, I have to call someone with money. That is the problem. Every person shall have the right to get information about his or medical treatment. See, the rights given by WHO to the patient. The Nepalese Constitution has spelled that a doctor has to inform to the patient that what has happened to the patient, what are the alternatives in the treatment, what are the risks and what are the costs. This is given in this Constitution. And it also says every citizen shall have equal access to health services. Every citizen shall have the right to access of clean drinking water and sanitation. Okay? So, it is in writing. It is in the Constitution. And it is mandatory. I can go to the court if I do not get safe drinking water. Well, talking about some issues. What are the problems? What are the public health problems in Nepal? There are hundreds of public health problems. Hundreds of problems. Since I am from the pharmacy field, I have seen closely about the issues related to pharmaceutical sectors. Essential medicine exists but not practiced. It is your concern. As a public health personnel, there is provision of essential list, and the Constitution says the essential list, the basic medicines will be provided free to the people, but it is not in excess. What has to be done? There are few guidelines for standard treatment, especially in the primary health care. Up to primary health care level, there are standard treatment guidelines, but not compliance. Very poor compliance. And we have very few treatment protocols. There are some protocols in TB, leprosy, malaria, HIV, AIDS, Kalajar, etc., but several not existing. Even the big hospitals at private sector, they have not developed the protocol of treatment. That is why there are several incidences. The patient party beats, the doctors or vandalize the hospital. And there is prescription anarchy, which has led to antimicrobial resistance. The world is facing AMR problem. It's a big issue. And there is a rule. Antibiotics should be prescribed under prescription only, and antibiotics can sell only the person trained or the person having qualification of pharmacy. Unfortunately, the practice is different. The practice is different, and there is provision of life imprisonment if someone sells antibiotic without prescription. But what to do? Not in practice. And there is increased cost of treatment due to prescribing anarchy and incidence of several ADR. And there is use of unnecessary pharmaceuticals, and this has also increased cost of treatment. Several unnecessary. Even the nutraceuticals are being used. And what is the use of nutraceutical? Everywhere in US also, there are nutraceuticals. But consumers are made aware about the nutraceuticals, use of and importance of nutraceuticals, but our consumers are not aware. Increased false and misleading advertisement. We made a case, several misleading advertisement, because consumers are unaware. They go with advertisements. And pharmaceutical companies are not having ethical promotion and false claim of the harbor products. There are several harbor products being used. No efficacy, with nobody knows what is the efficacy. Nobody knows what is the possible risk associated with the things. So, access and equity in health, in practice, difficult. Quality of health professional education, cost of private sector service, and use of unproven drugs. These are the issues. I don't want to conclude. This is all my presentation. I would be happy if you have a specific question, especially related to the pharmaceutical and the consumer rights. I will be ready to answer you. I have no conclusion. The conclusion is there is problem. Conclusion is there is problem in health sector, and we have not able to establish the right of the patient. We have not been able to establish the right of the consumer. What next? You have to think. Thank you very much.
Thank you very much. I don't know if you missed out any consumer rights, but it seemed to include almost everything. Thank you. Any questions or comments? Ms. Hassan? Thank you.
Yeah, thank you very much for the information. I mean, the presentation was very informative. But my question is concerning the Nepalese context. I mean, you mentioned that most of the rights of the consumer are prescribed in the constitution. But are there any initiatives in Nepal here? You know, a large proportion of people, like in other developing countries, they live in the rural areas or marginalized communities, and there's no access to information about their rights, duties.
Yeah.
The issue of informed consent. Someone has mentioned. Are there any initiatives on the ground to ensure that?
Well, it's a big problem. Most of the people live in rural areas, and they are unaware about the rights. And it becomes the responsibility of the government to make aware the society. And the new constitution has been implemented from last year, I have to say. And let us hope. We have to plan a lot to make establish the right of health. It is 100% is not possible everywhere. Nowhere is possible. But we as a consumer organizations, we are conducting several awareness programs to the different part of the countries, and we have been involving in the policy making process also. I think in years to come, there will be some change.
Any other question?
Yeah, please.
Please use the mic. We can't hear you.
I think it's a general question concerning this issue of confidentiality. Don't you think that, I want your opinion, that if you go to Western countries now, the issue of confidentiality in public health care, especially in the context of consumers, has changed over time. There are issues which in the old days, if you go into rural areas, even in the urban areas, depending on the religion, the cultural context, have changed. They're no longer confidential because society has changed with information, globalization. Don't you think in our developing countries, I don't know how the situation is, because of cultural issues, religious issues, sometimes we are stretching this issue of confidentiality too much and could have an impact on healthcare, ethically and also in terms of services?
Yes, thank you. This matter, what I think is my personal opinion. Once you know, my responsibility becomes to brief all about the disease, all about the medication, everything. It is the choice of the the consumer, choice of the patient the patient himself or herself may agree on to change heart to confidentiality, may not be confident in the such things, but cultural and some other things has in certain part there is they are not worried about their confidentiality. In our context, if you say in our context, hardly any people do not want to expose. They agree, and they can give right to the provider, the clinician, that it should be. They are not aware that it should be within confidentiality or it should be, open.
Thank you, sir,
Yes, please.
for enlightening us. I can speak.
Yeah, speak loud then.
Yeah. Sir, I think that if in a coin we have both sides.
Yeah.
So you have very well talked about one side, but this time there are so many my doctor friends.
Yeah.
So I will take their side. Sir, if you see that I think that patient and doctors relationship is on trust. Like if I say in this fast,
It should not be on trust only. No.
maybe
I don't agree.
one factor. It is
Yeah,
started
it
with
may
trust.
be, but it is not the matter of the trust. It is my right. So, trust everywhere. We trust people. Like that, you can say it is a trust.
Yeah, that's right. You are right. But what I'm saying that when we say that patient have rights, he wanted, like in this fast growing country, if I have a headache, I want a medicine which can make over my headache in 5 minutes.
Okay.
Because patient demanded. Because being a consumer, if I go to a doctor, I have any pain, doctor please give me that medicine which can relieve me in half an hour, 1 hour. You're getting?
Yes, I'm getting. I'll answer this. This is your duty, the clinician's duty, to make, they realize, convince, inform, counsel that a tablet is not the solution. It becomes the duty of the service provider, the doctor or nurse or pharmacist.
You are right. I am not a doctor,
Okay.
but I am a consumer.
Okay.
But I go to the doctor, and if he talk to me this, I am in a pain. If I go to a doctor, he say, if you have a headache, just go have a relax and go. I will not go to that doctor again.
No,
It's a mentality, sir.
Again, there is a problem. What is the problem? Problem with the doctor. Problem with the doctor. You couldn't, the counsel the patient with empathy. Okay. You should be able to counsel.
Consumer, patient or doctors?
Pardon?
Consumer. Who's the consumer this side? Doctor is counseling to the patient? Because the doctor is also consumer for pharmaceuticals.
Yes.
They are divided
Yeah.
this side, this side.
Yeah.
So that's why if doctors when discussion or manage the patient, who's the consumer?
No, if doctor takes medicines, the doctor goes to another doctor or any service to the service provider. Doctor also a consumer.
Yes, definitely doctor's consumer is the main things, because the patient always follow the doctor's rules and regulation and advice.
No, this is happening from long back. You know, we all trust doctors. We must trust health professionals, doctors, health providers. Any organization we should trust, and we are trusting it. But we have a question:
Yes.
whether we are getting the outcome of that trust correctly or not, adequately or not. That is the question.
Because it's a hidden of gift, lots of gift in there. So that's a consumer to pass it out for pharmaceuticals in any shops or patients. But the main thing I always fall in the side sector in the group doctors, I think. So that's why it's the consumer, main consumer is doctors.
Yeah.
I can address many examples here, but one thing I can say, many of my teachers used to practice ethically. That means textbook practice. So
A professor cannot practice, cannot practice as textbook.
Yeah.
It is dynamic.
yeah, it is
It is not the same service. If you are hypertensive, you are hypertensive. The same age, same weight, everything same. The treatment is not same. What I have to communicate to you is not the same. It should be different, and it is always different.
Yeah, I am saying that it's always different, and there are ethical guidelines for that also. But the problem is, with the development of internet and so many doctors are available there. So, in case of pediatric doctors, if your child is sick and you go to a pediatrician and they just advise you that your child it's just a fever, you don't have to worry about, you just wait for 5 or 6 days and this fever will go away by itself, you're not satisfied. Many of my teachers...
I am not satisfied means you could not communicate me properly.
Yeah, because what I am saying, with the development of internet, if you give this kind of symptoms like I have fever, I have nausea, I have vomiting, they will give a list of diseases that you have, and there are drugs for that. So even if I have convinced you that you don't have anything, in front of me you will say that okay, I'll not do you anything, but you are giving me a fee for your advice, and I'm not giving you any medicine. You're not satisfied enough. So what happens? You go to another pediatrician, and maybe he will give you just paracetamol or any antibiotic, and after 5 or 6 days you will just get rid of the fever by yourself, and you are saying that he is a better doctor than he.
Yeah, this is the reality, but you are not a professional. It is a reality. I understand you. But this situation, there are several reasons. Preconceived, a belief that brings the attitude, and that brings the intention and the behavior. So, to change the behavior of a patient, you have to change the belief. It takes time to change the belief. It is not easy. And the belief of the service providers and the health professionals should be changed, and the belief of the patient or consumer should also be changed. So if we hit to the intention, no, not possible. If to change the behavior, you have to change the belief.
Yes.
Thank you very much.